Hello, everybody, and welcome to my YouTube channel. My name is Dr. Peter, and today I want to talk about exams. Like, this is supposed to be the ultimate exam guide, the ultimate MB guide. Now, this student is actually like tailor made for medical people, like medical students, professionals, young doctors, and the rest. But I think it's going to also apply generally to everybody who is going to take exams at one point or the other. Now, before I delve into this video in particular, I'm so excited and I'm so grateful. And I want to say thank you to everybody who has supported my channel from 0 subscribers to 3,000 plus subscribers. Thank you guys. Thank you for watching. Thank you for liking. Thank you for subscribing. I get shout outs from now all over the world, and contributing, thanking me for one video or the other. But more importantly, it's you guys that have been subscribing, that have been liking the videos, and I'm really super grateful. So now let's get straight into the exams, the videos for this exam, this particular. I want to give some context before I get into this video. Every exam varies. The strength of every student varies. The intensity of every exam varies. However, before you don't discard these ideas, like think about these ideas, think about them very well. Now, they are from my experience, from studies of quite a number of books, in search for academic excellence, from talking to a lot of seniors, from watching a lot of videos here on YouTube, and even like other sources in preparing for exams. So before you give up on the information you're going to be getting here, I really like you to think about them, evaluate them, and be very think about them critically and how you could apply them into your preparation for the various exams you're going to be using before you discard. Now, as you know, MBs are the promotional exams. They are like the exams that summarizes all you have learned in the past, and also like a transitionary exam to another phase, to another class in medical school. Now, typically your first MB is going to be after 2 years of preclinical. So you're going to do one exams after your second year, and then another exams after your third year. Now, the exams at the end of your third year is usually regarded as your first MB. It's after your fourth year, second MB, your third MB, and then your final MB. So that's just to give you a structure, sort of what we're talking about here. And then these exams, as I said, they are comprehensive exams. They are usually in 5 phases. The 5 phases are usually they are practicals, or they are clinical parts of the exams, or practical or clinical exams. There are also like the multiple choice questions, popularly called MCQs, multiple choice questions. There are also the essay parts where you're going to actually be writing the exams out. Sometimes, and this applies a lot when you get into clinical school, there'll be something called picture test. Even in the preclinical school, you also have picture tests, but maybe we'll not call them picture tests, but we'll call them steeplechase. But you have to answer questions by looking at pictures, so we'll call them. Now, the last part of every comprehensive exam is the oral exams, the interview, popularly called viva voce, where you are going to be talking, with your examiner, so that they can really access who this student is. So they don't just judge you from your script, they judge you also in person, in how you can deliver the knowledge that you've accumulated over the year or the years, as the case may be. So that's just to put it in context. That's what we mean by an MB. There are about 6 or 7 things I want to talk about in this video that will be like the ultimate guide to your MB. The first and the most important I want to talk about is, if you're watching this video, you're likely a medical person. If you're a medical person, the most important thing, we always say, it is a cliche, health is wealth. The first and the most important thing is your health. I really need you to be aware of your health. See, if you get sick, if you get broken down, like if you lose your health for one reason or the other, or even if you don't really get sick, but you are not in optimal shape, you can't prepare for the exams. And even if you are in the exams, you can't deliver in the exam. I always tell students and my friends about a particular experience I had. It was in my third year in medical school. I was prepared for my exam. It was neurolocomotor, head, neck, and back. It was a very large exam. We had read a lot. I prepared for the exams. I knew the anatomy from back to front. I could do my pathways in reverse. I was ready for the exam. I was so ready that I started taking my health for granted. On the day before the exams, I was super engaged in my book, and I couldn't really eat well enough. On the exam morning, I had plans for breakfast, and then before when you prepare for exams, you oversleep and stuff like that. So I woke up late, I couldn't get time enough for breakfast, and then I had to rush to the exam hall. Everything was still fine until I got my question paper and we're supposed to start. And at that moment, that's when I started feeling the classical symptoms of neuroglycopenia. I started trembling, I started sweating, I started feeling dizzy, I started getting confused, I started getting palpitations and intense hunger. Now, it was a short time exam. So I had barely 2 hours for 6 questions, and you're supposed to draw anatomical structures in that exam, and I could not deliver. I was super pained. I had to do meditation exercises in the exam. But like, I didn't need to do all that. I could have as well just prepared very well, eating breakfast, and delivered well in the exam. First and most important thing, take care of your health. At this exam time, if you are preparing for an MB, most schools, most institutions usually give a period, a fallow period of preparation for the MB. Usually it's within a week or 2 weeks. It might vary, maybe 10 days, maybe 5 days, but you have roughly a week to prepare for the exams. Now, if you have a week to prepare for an exam, in this period, that's the time you're likely going to sleep more, because the more you study, the more your brain needs to rest and process the information you are getting into memory, short term and long term, as the case may be. So, yes, that is going to happen to you. You're going to sleep more when you are preparing for an exam. And it's not the time to like fight it. Yes, you have to have discipline, prepare your time, your study time, and all that. But have it in the back of your mind to rest. Have it in the back of your mind to eat very well, like to eat well for your exams. Have it in the back of your mind to take care of yourself so that you can deliver in your exam. Yeah, I know you have to read. I know you have to probably do all-nighters at some point or the other, but I need you to be careful with your health. It is most critical. If you are ill, you can't deliver in the exam. And if you can't deliver in the exam, then all your stitching and unstitching is in vain. So take care of your health. That's the first and most important thing. The second point we're going to talk about is details. Now, these details are trivial until they mess you up. So details such as get a box of stationaries. Get a box of stationaries. Have all you need: your pen, your pencils, your erasers, your sharpener, your ruler, whatever you're going to need. Have them comprehensively together. In some institutions, in some schools, you are not allowed to bring stuffs into your exam hall. You're not even allowed to bring a wristwatch, except it is analog. You're not expected to bring a lot of things into the exams. And depending on the local situations of your institution, of your school, and you can decide, and you should know this, like you should really know this now. So these are the details. If you are allowed to bring writing materials, then have a comprehensive collection of writing materials with extras, so that when you get into the exam hall, what you have left is to just deliver in the exam. Now that's the first thing. Get all your documents in place: course registration, identity cards, exams IDs, all the nitty-gritty that you're going to need to for the examiners and for the invigilators to access you before you get into the exam. Please have them handy. Unfortunately, I have to be telling you some of this experience from negative, painful experiences. I've been delayed in an exam for 30 minutes. For an MB, my 50 MB, I was kept out of the exam for 30 minutes. It was a 3 hours exam, and I blew 30 minutes outside just whiling away my time when my mates were inside the exam hall doing, my classmates were doing a lot. In 30 minutes, 30 minutes is a huge amount of time when it comes to an MB. And for those of you that have done MBs before, So my point is, and it was because I did not have my course registration or something like that. Get all the details you need for your exams and have them ready, so that you can deliver properly in the exam. Talking about some of the things you're going to need, it's very likely to take things like clothing for granted. But most MBs are a week long, or 2 weeks, as the case might be. You need shirts and trousers, gowns, skirts, and stuff. Get them ready, press them, launder them, dry clean them, and have them ready, so that all you have to think about in that exam, in that intense week, is to get up, get into a beautiful gown or shirt and tie, have them all pressed so that you can look good. You can't, you have to look good sometimes to actually feel good. And confidence is a huge part of the exam, which we're going to talk about later in the day. So get all those details ready. The third thing we're going to be talking about in this video, this is probably the heart of this video. This is what most of you are probably watching this video for, is the knowledge, the information that you need for the exams. Now, I'm going to drop a hack here. The most important thing you are going to probably need for every exam or any exam you go for is to talk to people who have done that exam before. Likely going to be a pioneer set or a pioneer candidate for an exam. It's likely that any exam you're doing before has been done, or a version of it has been done before. Even if it's computer-based, if it's paper-based, whatever the modality of that exam is likely that exam has been conducted before. The biggest hack you can actually have for that exam is to talk to people who have done the exam before. Personally, I prefer to talk to at least 3 to 5 people who have done the exam before. And I varied by year, I varied by gender, I varied by performance. So while it's very important to talk to the people who have done excellently well in the exam, it's also important to talk to people who have not done so well in the exam. For the people who have not done so well in the exam, I ask them things like, what was your biggest mistake? What would you wish you had known before you went into the exam hall? what would you say is the best decision you made preparing for this exam? In contrast, the people who also did well, you asked them exactly the same thing. How did you do so well? What was the biggest mistake you make in the exam? What would you do differently if you were to take the exam again? See, if you do this for 5 people, and 5 of them have spoken to at least one person before the exam, it is very likely that you're going to be taking the exam with the knowledge, the organic knowledge, the experiential knowledge of people who have of like 20 people who have done the exam before. It's very unlikely that you're going to fail an exam if you are that aware. Things to note are, things like time peculiarities. Is there going to be time in these exams? Am I supposed to write in details? Is there going to be a lot of drawing in the exam? Am I expecting clinical scenarios? Am I expecting direct straight questions? Is it recall? Is it my comprehension they're going to be testing? And for MBs, they're going to test all these things. So it's important that the subset of the exams, right? Like the subset of these exams, that you have an understanding of how the questions are likely going to come so that you can be ready. And all these things we've spoken about so far, none of them involves reading for 25 hours a day. We're talking about common sense things that you can apply that will have a strong effect on your performance overall. So talk to people who have done the exam before and talk to them in details. Don't just talk to them flippantly. Talk to them with piercing questions so that they can give you information that will not be gotten casually. Now, at this point, I think while I'm losing the order, I've told you 3 things to do in preparing for an exam. I gave you the general context of the exam. I told you about your health and your wellness before you go for the exam. I told you about the details to take in. And then I'm telling you about, people you have to talk to before you get into the exams. Another part of preparing for an exam that you have to know, especially if you're in medical school, is to look at questions. You have to look at previous questions, like questions from past years, from previous years, probably called past questions. When you look at past questions, you are going to see the instructions of the exams you're going to take on the past questions. So you are likely going to see things like time, things like questions, number of questions to answer, number of if they are going to be composite questions or things like that, and the subset of questions, and also how the examiners think. If you look at 10 years, of a faculty's questions, for example, let me take a random. If you look at 10 years of anatomic questions in an MD, for example, you are likely going to have seen how the faculty members have been thinking for the past 10 years. Now, there's a lot of things an anatomic lecturer or teacher can ask you. However, if you look at 10 years of MBs, you will see that these are the most important things they expect you to know. These are the kind of things they like asking. And when you have that kind of information, by the time you see recurrence in the past questions, those are the questions, those are the subjects, those are the things you have to prepare for optimally. So when you see high-flying students, it's not because they have their textbook wired for sound. It's not because they have super memory to memorize everything. Some do, but for most of us who are excellent students, what we do is we try to predict what is going to happen in the exam. Now, we have a general wide-based knowledge like every other medical student do, but we also have specific expectations of what the lecturer expects you to learn. And when you know this, it's like you are waiting for your a classic text says the Lord has delivered my foe into my hands. That is when you are being served the way you expect it. And the way to know this is to comprehensively look at questions, not just flippantly looking at them, but you look at them and, okay, this year, this came out, this year, the last thing came out. So it's likely that these are the sets of questions that this examiner prefers. And the thing is, most faculty members in most medical schools have been serving for, 15 years, 25 years. So they have been, in the faculty for a long period of time. So what they expect, they've gotten into a routine of teaching medical students and examining medical students. So you can actually look at that and have a very good idea and expectation of what to expect in the exam, and that will help you in your delivery. There are two aims, right, for most exams. The first aim is to organize your knowledge so that you can have knowledge to excel. The second part is the goal is also to pass the exam. Something very sad is when excellent students or hardworking students fail exams, and they don't fail because of lack of knowledge. They fail because of lack of skill in performance in the exam. And as a medical person who has taken quite a number of exams also in my medical experience, I'm going to be telling you things that you need to be aware of, things that you should think about now that you are preparing for exams. These are the kind of things you should be thinking about. Now, you need to think about your writing speed. If it's an essay exam, what is your writing speed? Now, many people will not take this test, but if you write an essay about yourself, who you are the person that has the most information about you, and then make it as fast as possible. Time yourself for 2 minutes and write an essay about yourself for 2 minutes as fast as possible. Now count the number of words you have written in 2 minutes, divide it, and then find your average speed per minute. Now, if you have done this, you will have an idea of your average speed per minute. Now, most people have an average of 15 to 20 words per minute when they're writing. As fast as that is, if you are in an exam situation and you really need to get through a lot of questions in an essay exam, like you're going to have in medical school, you're going to need way more speed than that. You're going to probably be needing upwards of 25 words per minute to be able to deliver properly in an exam. And this is keeping in mind constant that you already know the information you are going to deliver. So you actually have to have a faster writing speed. Examine it, test it, and improve it today. I can also tell you from experience that your examiners are not going to be looking at the beauty of how you're writing. And most medical people have terrible handwriting, right? But they're going to take the patient and look through your papers. Don't make it so terrible. But your goal is not beauty. Your goal is delivery, right? Delivery. So improve your writing speed. Access your writing speed. Find ways to improve it. If you have to sacrifice the beauty of your writing for speed, then it's going to be a good trade-off in the long run. Something else to note is accuracy. By the time they're asking you questions, even if you want to generalize, and we're going to talk about outlines here, but even if you want to expand whatever knowledge you have in your delivery in the exam hall, you have to also be accurate. If they ask you something, there's no need to rigmarole. There's not even time to rigmarole. You have to get straight to the point. And this is an art. You are going to learn this art by preparing through past questions, but you have to find a way to deliver directly when they ask you questions in the exam. Have it at the back of your mind that you are always going to draw in every exam. Now, I'm saying this not because you have to draw in every exam, but so that you will not forget that drawing is a very critical part of the marking scheme of most exams in medical school, especially in the preclinical years. When you have this at the back of your mind, you already have a structure, a framework of how answers are supposed to be delivered, especially in the written part of the exam. So you are fast, you're accurate, you have diagrams. Now, the other part that we'll talk about is your presentation. Also, people call this outline, the sequence with which you deliver your answers. And there is a very famous acronym or mnemonic that we say in medical school that captures most of the subsets of your presentation, of your delivery in terms of answers when you get into the exam hall. Question in an exam, the medical exam, you are likely going to introduce that topic. For example, medical exams are a set of questions that are going to be asked to medical students to test their understanding of what they've learned over the years. So you have to introduce, like I introduced this video, so most times you have to introduce or define, or most times introduce and define. The next one, as I said, this is like a comprehensive, it will not apply for everything, but it's good to have it so that you can have a framework of how to present answers in the exam. If you have this at the back of your mind, why it might not apply to every question, right? Or every subject of questions. It gives you a framework of how to answer questions. Now, another very critical thing I'm going to talk about is the order of study. Now, if you have, and I'm going to use simple subjects here just for the illustration of what I want to talk about, is to study in reverse order. What we want to talk about is study in reverse order when you're preparing for an exam. To study in reverse order means this. If you have an exam to deliver, or let's say an MB, and you're going to be starting with anatomy, biochemistry, physiology, for example, it's best to start reading physiology, then biochemistry, then anatomy. The reason why is because, since your timetable is in this order, it is best to read in this order. That way, if you have anatomy first, biochemistry second, and physiology third, it's best to start reading physiology first, biochemistry second, and then anatomy last, so that the last thing you prepare for will be the first thing you're going to write. It's going to help your short-term memory, and then you can begin to interrogate like that. It's very important to know this so that you don't study in a scattered manner. The reason why is because you're going to be having a limited time to prepare for your exams. So you need to use all the logical means to be able to deliver well in your exams. And one of the logics you're going to apply is to study in reverse order. Now, if you have 3 subjects to study for in an MB and you have 3 weeks, it doesn't mean you're going to use 1 week for an exam for a particular subject. It means you're going to allocate it such that you're going to be using the time that every subject requires. Now, it doesn't mean you're going to use 0 or no time for a particular subject, but the subject that needs more time should take more time. It's not about equality. In this situation, it's about equity. You have to use your time the most appropriate way for the various papers you are going to be taking. And this is very important to also note. Now, something many students ask me about is the issue of should I study in group or should I study alone? Different thing works for different people. However, general guidelines. If you want to study in group, it's best the group is not so large. 3 to 5 is optimal. 8 is a crowd. 7 is a crowd because there's too many people talking, there's too many cooks spoil the broth. And when it becomes 2, it might be boring. 3, you can adjust things around. 4, maybe great. 5, okay. 6, maybe too much. So if you are going to study in a group, make the group the right size. Next thing is there are things not to study in groups. Now, anything you can read on your own, maybe you should not study them in group. But if you want to look at past questions together, then it's best to look at them in a group. The reason why is because when you're looking at past question alone, what you know is what you know. But if you're looking in to get them as questions in a group, you are likely going to hear things from other people and hear how they respond to questions and pick things, the subtle things from them. But if you're looking at essays, in group, it might be boring a little. But as I said, this is various things apply to different people. So it's best to look at questions in a group, practicals in a group, clinical simulations in group. But when you want to look at essays and things you have to read, maybe you look at them privately. Now, let me give you some general details as someone who has also taken the exam before. Now, fear is normal. You're going to have some fear when you're going for an exam, some expectation. Yes, you have things at stake. You have to promote, you have to graduate. There's even the fear of, do I know this enough to become a doctor in the long run, or a nurse, or whoever professional, or who you're going to be? Do I have enough of the knowledge to know this? Now, that fear is normal because it's a big deal, it's a critical thing. However, don't let the fear paralyze you. The way to go to overcome fear is to dissect the exam, break it down into pieces, and then begin to look at them. And don't forget, the examiners don't expect you to know everything in the textbook. I mean, that would be theoretically fine, but they don't expect you in practical terms to know everything in the textbook. However, they expect you to know the most important things. And the way we've been looking at this video so far already begins to tell you the kind of things to expect. You need a lot of emotional support and social support when you're preparing for an exam. You need people to talk to allay your fears. It's important to cultivate these people before the exams, because if you don't have a social tie with someone, with a parent, a loved one, or a counselor, if you don't have a relationship, it's hard to begin to start them at the brink of the exam. It's better to have relationship. There's a big deal about emotional support when you're going through things that are difficult in life, like medical school. So it's important to have people that would help you in medical school. Social support, emotional support, not underrated. I think we should see the importance of this thing is so huge. On graduation days, what do we hear our friends say? Thank you, mom, for being by my side, for supporting me. Thank you, dad, for your support. Or to everybody recognizes the importance of emotional support and social support, but we neglect it when we should cultivate it. So find people, find a community, join them, and let them support you. Support them when they need your help, and then also let them support you when you also need their help. The more the merrier. Like, life is not supposed to be lived in an island. There are many aphorisms to use when you are thinking about. Don't cheat. There's no time to cheat. Like, cheating is too technical in medical school. It's easier to learn and deliver. The reason why is because the fear, the worry, the technicalities of trying to cheat in an exam is too much. It's too stressful. You can as well just learn everything yourself and then be able to deliver enough to pass the exams. Don't worry if you are going to be a good doctor. You are going to be a good doctor because medical knowledge is redundant. You're going to have to learn through things. And before you actually get to manage a patient as a person, you are going to actually do an apprenticeship period called internship before you get there. I'm not saying you should take your studies for granted, but I'm telling you not to be paralyzed by the fear if you are going to be adequate when you become a doctor. You can also watch my video on medical imposter syndrome to understand more of what I'm talking about. It's important to be punctual when you're going for exam. If you're not punctual, you probably have lost already before you start. I've been delayed for 30 minutes in an exam before getting to the exam. Now, I passed that exam, but I wish I went earlier, because if I had gone earlier, probably I would have done better, probably even gotten distinction. And it still haunts me to today, and I'll never forget that. Try to be punctual when you're going for your exams, for everything, but especially for exams, and most especially for MBA exams. Submit your paper. Don't submit your past question. Many and time again, we've heard of students who were so excited that they were done with the exam, and on going to submit their script, they submit their past questions, the questions, rather than submit their exam script. Please don't make this mistake. Submit your exam. Submit your question paper, your answer booklet. Don't submit your question paper. Now, follow the instructions. That goes without saying. If they say one question is compulsory and you don't do it, you've lost. So please look at the instruction carefully. My guide is the rule I have in my head is read the question, read everything twice, and when you get the question, look at the back to make sure that there's nothing left at the back of the script. All right? So read the question, read the instructions carefully. Answer with outlines. We talked about outlines already. Now, Start with the question you know the best. Start with the question you know best and end with the question you know last. Maybe there will be no time to even do that, and then of course you can excuse yourself and say there's no time, but start with the one you know best. Don't forget, the summary of your delivery in the exam is accuracy, speed, and clarity. That impresses every examiner: accuracy, speed, and clarity. Maybe there'll be a follow-up on this video because of the length, and then we can delve into the subset of the details of all these things we've talked about. If you have any questions, please leave them in the comment section below. It's really good to be back online. Thank you very much, guys, for watching my video to the end. Thank you for supporting this channel. My name is Dr. Audu Peter. I'm a medical doctor and content creator working currently in Nigeria, and I'll see you in my next video.